Hello everyone, welcome to my channel Samvedna Psyche. Today's video is for IGNOU MAPC second year students specializing in clinical psychology. I am here to guide you through the assignment solutions for MPCE 012 Psychodiagnostics. Whether you are unsure how to organize your answers or need help understanding the requirements, this video will make it easier for you. Let's dive in and go step by step through the assignment solutions to help you complete them effectively. After including the front page and the question paper, write the subject name, code, and the other details as appear on your screen or as mentioned in your question paper for assignment. You'll start writing your answers. Let's start with section A. Question 1. Explain the concept of psychodiagnostics. Discuss the data sources for psychological assessment. Psychodiagnostics refer to scientific process of assessing an individual's psychological state using a combination of methods such as standardized tests, interviews, and observations. It emphasizes both observable behaviors and clinicians' ability to interpret symbolic or unconscious element. According to Korchin and Schulberg, 1981, psychodiagnostic involves integrating data from different sources to offer a comprehensive view of an individual's mental health, differentiating it from general psychological testing. The clinician's expertise plays a crucial role in ensuring the accuracy of the psychodiagnostic process by carefully synthesizing multiple data points to form a valid assessment. Actuarial and biographical data. This includes life history, educational background, and medical records. In clinical settings, it helps identify factors contributing to psychological issues, while in educational settings, it supports decisions like accommodations for learning disabilities. Behavior traces. Behavior traces refer to physical byproducts of actions such as handwriting or digital footprints. They offer insight into unconscious psychological states and serve as supplementary data in clinical or forensic assessments. Behavior observation. Direct observation of behavior in real world settings like classrooms or hospitals provides real time data on an individual's functioning. This is especially useful for capturing patterns that may not appear in structured tests. Behavior ratings. Ratings provided by those familiar with the individual, like parents or teachers, offer standardized assessments of behaviors but can be influenced by the rater's bias or perceptions. Expressive behavior. Non-verbal cues like facial expressions and body language provide insights into emotions. Clinicians observe expressive behaviors to detect discrepancies between what a person says and how they behave. Projective techniques. These techniques, like Rorschach block test, reveal unconscious thoughts by interpreting responses to ambiguous stimuli. These techniques are valuable when combined with other objective data. Interviews, whether structured or unstructured, they gather detailed information about the individual's symptoms and history. Structured interviews follow specific questions, while unstructured ones allow for open-ended exploration of issues. Questionnaires. Standard questionnaires provide consistent data across individuals but may be limited by the respondent's self-awareness. They are often used alongside other methods to create a comprehensive assessment. Objective tests. These are to measure cognitive functions and personality traits, providing quantifiable data for comparison across population in clinical and organizational settings. Psychophysiological data. This data includes measurements like brain activity and heart rate, offering insights into relationship between psychological and physiological process. This data is useful for understanding conditions like anxiety or automatic dysregulation. Question 2. Discuss the formats and types of interviews used by clinical psychologists. Clinical psychologists employ different interview formats to assess and diagnose clients, including structured, semi-structured, and unstructured formats. Each format offers unique advantages depending on the assessment context. Like structured interviews, These consist of standardized questions often outlined in published manuals. They require minimal clinical judgment and are commonly used to gather specific diagnostic information. Examples are like diagnostic interview for children and adolescent DICAR and structured clinical interview for DSM-4, that is KID 1. These allow for systematic comparison across clients. Semi-structured interviews, they offer more flexibility while maintaining a framework of questions. Clinicians can adjust the phrasing and order of questions, promoting a natural dialogue. This format allows for deeper insights while still adhering to some structure, making it widely used in both research and clinical setting. Unstructured interviews, these are customized to clients' needs, relying on the clinician's judgment. This format lacks standardized questions and requires significant expertise, making it prone to biases but useful in tailoring the assessment to the individual. Next is types of interviews. Clinical psychologists conduct several types of interviews, each serving a distinct function. Initial intake assessment interview. This interview provides an overview of the client's problems and help plan clinical goals. It often includes elements of mental status and diagnostic interviews to gather comprehensive information. Mental status assessment. It assesses current psychological functioning, focusing on distinguishing between normal and abnormal behaviors. Clinicians observe various aspects like speech, mood, and cognitive functions to aid in diagnosis. Crisis interview. These interviews address clients in acute distress, addressing the risk of self-harm or harm to others. Conducted in emergency settings, crisis interviews focus on immediate safety and interventions. Diagnostic interviews, they aim to classify concerns based on established criteria like the DSM, and it helps confirm or rule out diagnosis, especially in cases with comorbid conditions. Computer assisted interviews. Technology has introduced these type of interviews which use decision trees for follow-up questions and provide an efficient confidential means of data collection. Exit interviews, it occur at the end of the treatment and it offers a review of therapy, progress, and preparing clients for future challenges. In conclusion, the variety of interview formats and types enables clinical psychologists to gather critical information, enhancing diagnosis and treatment planning tailored to the client's specific needs. Question 3. Describe FAMHA and highlight its reliability and validity. The Functional Assessment of Mental Health and Addiction, FAMHA, developed by Anderson and Belfield in 1999, is a clinician rating scale used to evaluate individuals with dual diagnosis across a wide range of symptoms and functional domains. It was designed in response to clinical and outcome goals by the Department of Health and focuses on assessing treatment outcomes for substance misuse problems. It particularly aims at three types of addicts: mentally ill substance users, MISU, substance using mentally ill, SUMI, and medically compromised substance users, MCSU. The scale highlights functional deficits across biopsychosocial domains and helps to inform diagnostic assessments and treatment progress. Distinguishing between MISU, SUMI, and MCSU is essential as each group presents distinct challenges and requires tailored treatment approaches. Purpose of FAMHA. FAMHA quantitatively measures mental illness and substance misuse, helping clinicians understand the interactive effects of co-occurring disorders. It is designed to quickly provide diagnostic indicators and monitor treatment progress. MISU, SUMI, and MCSU patients are characterized by specific features which will take one after the other. First, the characteristics of MISU. They suffer from severe mental illness independent of substance abuse, usually require medication to manage psychiatric symptoms, with substance use exacerbating psychiatric conditions. SUMI characteristics. They exhibit severe substance dependence with psychotic symptoms caused by substance use, and these symptoms remit after detoxification. Characteristics of MCSU: these patients use substances to alleviate chronic medical conditions, resulting in increased dependency. Physical and psychological functioning often deteriorate over time. Development of FAMHA: FAMHA was developed to assess the unique needs of MISU, SUMI, and MCSU patients in real world settings. It evaluates not only symptoms of mental illness and addiction but also functional areas critically for community based treatment. The scale includes 46 items categorized into 6 dimensions, which are social legal, social community living, social interpersonal skills, mood, psychological functioning, and physical functioning. Pharma also collects demographic information, treatment history, and substance use data. It is designed to be cost effective and sensitive to treatment related changes, making it a valuable tool for clinical and research purpose. Validity and reliability of pharma. Pharma's validity and reliability are under clinical trials, but preliminary results indicate similarities with other scales like the SLOF. It is expected that FAMHA will show significant correlations with the Global Assessment of Functioning or GAP scores. FAMHA is designed to document substantial changes in behavior, mood, and functioning over time, making it a promising tool for assessing dual diagnosis patients. In summary, FAMHA is a comprehensive assessment tool designed to support both clinical treatment and research efforts. It helps clinicians measure and monitor treatment outcomes, making it highly applicable for dually diagnosed individuals dealing with mental illness and substance misuse. Let's move on to section B now. Section B, question 4. Describe the formats of self-report inventories. Self-report inventories are available in several formats, each with unique advantages and disadvantages. We'll start with interviews. Clinical interviews are among the most commonly used assessment methods due to their flexibility. They typically start with broad, open-ended questions that gradually narrow down to specific issues. This format allows for direct observation of the client, aiding in the therapeutic relationship. However, interviews can suffer from errors due to memory reliance and the subjectivity of the clinician, leading to varying conclusions. Structured interviews ensure consistency, while semi-structured interviews offer more flexibility while maintaining some degree of reliability. Primarily for diagnostic purposes, these interviews are used. Questionnaires. These tools are favored for the ease of administration and ability to gather quantifiable data. They allow for comparisons of client scores over time and reference against normative data. However, questionnaires may overemphasize traits and neglect environmental influences. Rating scales. These are flexible and often integrated into interviews or questionnaires. Rating scales assess behaviors by allowing clients to rate feelings or discomfort over time. The main drawback is the lack of normative data. Thought listing or think aloud procedures. These involve clients verbalizing thoughts during assessments, capturing individual insights and that may be missed by questionnaires. While flexible, they can disrupt client engagement and lack normative data. In summary, these formats tailor assessments to meet individual client needs effectively. Question 5. Define and describe direct observation and self-monitoring. Direct observation is a method in which trained observers record target behaviors in real time. This may involve brief observation periods or momentary sampling to check for behavior occurrences. Key characteristics of direct observations. They are conducted in natural settings. Behaviors are recorded as and when they happen, done by objective observers, and descriptions are clear and minimize inferences. Disadvantages of direct observation. While beneficial, direct observations can be time consuming and costly. It may lead to reactive effects if clients alter behaviors due to awareness of being observed, raising ethical concerns. Generalizability is another issue, as the observed sample may not represent the broader population. Types of direct observation. There are two main types. Continuous monitoring, where The behavior is observed as it occurs and is often influenced by Hawthorne effect. Time allocation, randomly recording behaviors at specific times before clients are aware, which requires a representative sample. Unobtrusive observation involves studying behaviors without participants' knowledge to reduce alterations. Ethical issues like informed consents are crucial. Examples include behavior trace studies, which helps in analyzing remnants left by individual, and disguised field observation, where researchers observe the behavior being unnoticed within a brook. Analog observation, it is conducted in controlled settings and it allows for structured assessment and differs from naturalistic methods. Self-monitoring involves clients recording their behaviors using formats like diaries to reduce memory errors. Clients are informed that their data will be cross-checked for accuracy. This technique can encourage desired behaviors and enhance treatment engagement. Together, direct observation and self-monitoring offer valuable insight into behavior, each with unique strengths and limitations. Question 6. Discuss the various models of psychological reports. Psychological reports are essential for clinical psychologists, facilitating effective communication of assessments and findings. There are three prominent models of psychological reports, each with its unique approach and purpose. The test-oriented model. In this model, results are organized by individual tests, each highlighted in separate paragraphs, while it clearly identifies data sources and is useful in forensic settings. It may limit understanding of the client's overall functioning. This model has fallen out of favor as it reduces psychologists to mere test administrators without showcasing their interpretive expertise. Domain-oriented model. Results are categorized by specific abilities or functional domains, covering areas like intellectual functioning and interpersonal skills. This model is advantageous when little background information is available, particularly in neuropsychological assessment. However, it may overwhelm the reader with irrelevant information, leading to criticism for lacking targeted focus. Hypothesis-oriented model. This model focuses on specific referral questions, presenting a hypothesis in the purpose for evolution section. It integrates various data sources to draw conclusions about the client's functioning. While efficient and clear, it may overlook useful information outside the immediate referral question. In summary, each model offers distinct advantages and challenges for psychologists based on assessment context and client need. Question 7. Explain memory assessment. Discuss the tests of implicit and explicit memory. Memory assessment is essential in psychological evaluation aimed at understanding an individual's memory capabilities and identifying impairments. Pioneered by Hermann Ebbinghaus, the field has evolved significantly with various tests designed to evaluate explicit and implicit memory. Test of explicit memory. These tests require individuals to consciously recall past experiences. Examples include the Adult Memory and Information Processing Battery, AMIPB, California Verbal Learning Test, CVLT, and Wechsler Memory Scale Revised, VMSR. Explicit memory assessment include pre-recall, where participants recall items in any order after exposure, cued recall, specific prompts assist in memory retrieval, and in recognition task, individuals identify previously encountered items among new ones. The remember or no paradigm distinguishes between conscious recollection and familiarity. Test of implicit memory. Implicit memory tests assess without conscious recollection, evaluating how prior exposure influences current behavior. Even individuals with explicit memory deficits can perform well on these tasks. Implicit tests include verbal tests, which include tasks like word stem completion based on prior exposure, and non-verbal tests include procedural tasks reflecting prior learning without conscious recall. Understanding the distinction between these memory types allows for tailored evaluations and a comprehensive assessment of cognitive functioning. Question 8. Discuss the stages and steps in psychodiagnostics. Psychodiagnostics is a structured approach to assessing a client's psychological needs comprising distinct stages and specific steps for thorough evaluation. Stages of psychodiagnostics include preparation. This is the initial stage which involves gathering information on clients' issues, negotiating referral questions, and planning assessment steps crucial for problem definition. Input. During this stage, data is collected through clinical interviews, observations, and standardized tests, forming a comprehensive picture of the client's psychological state. Processing. Here, the clinician organizes, analyzes, and interprets data, and this phase uses either a psychometric approach or statistical analysis or a clinical approach for qualitative insights and integrates information from various sources. Output is the final stage which communicates assessment findings to relevant parties, including the client and referral sources, and provide recommendations for treatment or further action based on insights gained during the process. Steps in psychodiagnostic include document client information to document key details, including the client's name, age, date of evaluation, examiner, and referral reasons. Summarize background information. The client's background is summarized, including medical, clinical, developmental, educational, and familial information. Gather family input. Input from family members enriches the assessment. Observe client behavior. Document observation during interviews and testing, noting behaviors during interaction. List test use. Include a list of tests administered with brief description. Interpret test results. Results are interpreted and linked to the initial evaluation reasons. Summarize findings and recommendations. The report summarizes all collected information, providing a diagnosis using standardized criteria and offer tailored recommendations for intervention. Ensure confidentiality. Confidentiality must be maintained in the report, and the report should be printed on a letterhead signed by the clinician. In summary, the structured framework of psychodiagnostic enhances diagnostic accuracy and supports effective treatment planning tailored to the individual client needs. Section C, Question 9, APA ethical principles. These include competence, that is maintaining high standards by the counselor, integrity, that is acting honestly, professional responsibility, that is understanding standards and test data, respect for rights, that is ensuring privacy and cultural sensitivity of the client, concern for client's welfare and prioritizing well-being, and social responsibility, that is advocating against the misuse of the test. Question 10, characteristics of abstract attitude. It involves detachment from experiences, self-accountability through verbalization, simultaneous consideration of aspects, reflection on common properties, ideational planning, and symbolic thinking, focusing on both the whole and its parts. Winconsin card sort test, WCST. It evaluates cognitive flexibility through sorting tasks based on changing rules. It measures the ability to adapt strategies by analyzing categories achieved, total errors, and perseverative errors. Question 12, Raven's Progressive Matrices. This intelligence test evaluates problem solving using perceptual analogies. The three versions include standard, which is for most ages, that is general, colored for young or intellectually impaired individuals, and advanced for high ability individuals, offering varying levels of cognitive assessment. Question 13, Stanford-Binet Scale. It is a widely used intelligence test for children and young adults featuring verbal and non-verbal subtests of increasing difficulty. The fifth edition balances both components adapting to individual ability. Reliability and validity of Rorschach scores. The Rorschach test reliability and validity are debated. Some studies report good inter-rater reliability while others question consistency. Validity findings are similarly mixed, though the test remains widely used. Question 15. Uses of neuropsychological assessments. These assessments identify cognitive, behavioral, and emotional changes and assess strengths and weaknesses and also infer brain dysfunction. These evaluations are applied in medicine, law, education, and research. Question 16. Types of projective techniques, which include associative techniques like Rorschach test, construction techniques like thematic apperception test or TAT, ordering technique like WAIS, and expressive techniques like draw person method, and each engaging subjects differently. Question 17. Edwards Personal Preference Schedule, EPPS. It measures 15 needs using forced choice items, minimizing social desirability bias. It's used in research and counseling with good reliability but limited validity data in the manual. Question 18. Tell me a story test is a multicultural test for children and adolescents using 23 color cards to explore interpersonal dynamics and emotions. It focuses on culturally relevant gender sensitive themes with reduced ambiguity compared to thematic apperception test. This brings us to the conclusion of today's video. I hope the assignment solutions for MPC 012 Psychodiagnostics were helpful and gave you a clearer understanding of how to tackle your work. As you continue with your assignments, make sure to pace yourself and approach each assignment methodically. If you found this video useful, don't forget to subscribe, like, and share it with others. Stay focused, and I'll be back again with another video.